I think it's important for people to have a very realistic view of what probiotics can do. They're not this sort of magical ingredient. And if you are taking a probiotic, but you're not paying attention to the other things, you're not really going to accomplish very much, if anything at all.
Hey, everybody. Welcome back. I'm Dr. Drew Ramsey, and I'm really thrilled that you're here with us as I have a just all-star, absolute doc star, a wonderful gastroenterologist, a physician, just wonderful human, Robynne Chutkan. You probably have heard of Dr. Chutkan because she is all over the media. She has 4 books that are out all about gut health, gut bliss, the microbiome solution, the bloat cure, the antiviral gut. She has been trained at Yale, at Columbia. She is on the faculty now at Georgetown Hospital. She's produced a PBS special on gut bliss, and she's just one of those wonderful experts who helps us translate all this new science about gut health into how we should think about food and lifestyle. So, Robynne, welcome, and thank you so much for joining us.
Thanks so much for having me, Drew. It's such a pleasure to be chatting with you today.
Well, first, I just want you to share a little bit about your background and how you got into the world of gastroenterology.
I come from a family of a few physicians. My father, who's 88, is a retired orthopedic surgeon. My older brother is an orthopedic surgeon, also mostly doing spine surgery. So when I started medical school, I said, of course, I'm going to join the family tradition and be an orthopedic surgeon. And I have to admit, I was not keen on orthopedics. So the way most of us do it, through a process of elimination, figured out that gastroenterology was really where I wanted to spend my time. And so that's how I ended up as a gastroenterologist. And
what was it about GI that intrigued you?
Yeah, so gastroenterology involves both men and women, which I love, all ages. Everybody has a gut. And when you think about it, it really is kind of central in the body, right? I mean, again, just think about where our gut is located. It's right in the middle of our body. So I like to think of it, without overstating it, as the engine for our body. It fuels our brain and our lungs and our heart and our kidneys and our adrenal system and our immune system. And so just as what's going on in the gut can affect all these other bodily systems, you can potentially improve all these things that are going wrong in the body through paying attention to what's going on in the gut. And that's kind of where we are now, right? The gut is really having a moment, and people are realizing the sort of central role the gut plays.
Yeah, no, I love the idea that when we think about nutritional psychiatry, a surprising nutrient to consider for your mental health is fiber. And that it has this really critical role for optimal health, optimal brain health, immune regulation, and it's something that most people don't eat enough of. But the idea that that's a mental health nutrient is really, it's kind of new.
And I love this whole idea of nutritional psychiatry because I feel like there was so much distance. I mean, when I was in medical school back in the late 80s and early 90s, and I know we both spent time at Columbia, that there was so much distance between the gut and the brain. These were organs that seemed to have nothing in common and no connection. And through work from people like Dr. Gerson at Columbia and the enteric nervous system and the gut-brain connection, and of course through your amazing work, we have seen that really these organs are very closely connected. And I love how you take the idea of a nutrient for the brain as opposed to a nutrient just for the gut, the way we think about it. And fiber is also a nutrient for our immune system, because we know fiber is converted into these short-chain fatty acids that are one of the main ingredients that modulate our immune system.
Well, I'm curious if you could share with us your view of the gut, because you've viewed it so much. And I think for a lot of people who aren't in medicine, who, haven't scoped a lot of, from above, from below. And so I was thinking about you in terms of eating. Like when you eat, are you like imagining all the stuff and where it goes and where it gets absorbed? Or how do you use and how can you help us use some of what you see about the gut to help us think about our GI system?
Yeah, and I'm particularly interested in what comes out, and much to the dismay of my family, there's a lot of discussion about stool and stool nirvana and beautiful stool at the dining table.
What is stool nirvana?
We'll circle. We're going to stick a pin on stool nirvana. But in terms of the gut, one of the things I want people to know is that the GI tract is very specialized, meaning that based on the geographic, the anatomic location, it looks differently, it functions differently, has a different role. So if we look, for example, even at two adjacent parts of the GI tract, like the esophagus, that long tube that the food travels through, and then the stomach, the organ that the food enters into, the lining of the esophagus is very different. It's a pale pink color. It's lined by different cells. And then when you get into the stomach, it's a beefy red color, and the cells in the stomach are very resistant to acid. So it's squamous in the esophagus versus columnar in the stomach. Different function, looks different. So as you travel, or as I travel with my endoscope, through the mouth into the esophagus, the stomach, the small intestine, which has three parts, duodenum, jejunum, and ileum. When you leave the stomach and you get into the small intestine, you see these finger-like villi. The villi that absorb stuff, you can actually see them. They're like tiny little finger-like projections, and of course, gazillions of them. And you see wave-like peristaltic contractions in the small intestine. When you get into the colon, you don't see villi because they don't have any in the same way they have in the small intestine, because the main function of the colon is not to absorb nutrients, but it's to absorb fluid, water. And the lining is shiny, and you can see the blood vessels very clearly. So it looks completely different, the landscape. Just as you would drive through different terrain, and you might see, pastures, and then forests, and then desert, it looks different, functions differently. And so it's really important to be aware that the gastrointestinal tract is not just this long hollow tube that's a conduit for food to go in and then come out the other end. There are all these different functions, specialized functions that happen along its length, and that's reflected in what it looks like. And it's gorgeous, by the way.
Oh, I love this notion of you watching the little villi fingers as they,
it's beautiful. It's like, you see those National Geographic videos of like the sea coral? It looks like that.
Oh, well, I think it also helps us all appreciate how we take something that's really complex and we call it like the gut, and eat fiber and drink water, and that it is this very specialized organ, set of organs, and they look different, they function differently. I'm wondering, using that view and thinking about maybe a little bit the different parts, if you could share with us some of the tips you find yourself giving patients kind of over and over again, those kind of tried and true, like, in psychiatry, sleep is something we always talk about. Are there some things around gut health that just people, are often missing or getting wrong that you find, they need a little direction with?
Drew, you're absolutely right that it is a complex organ, but the advice for how to keep this complex organ running is fairly simple. And the default setting for the gut, like for most of our body, is health. That's the default setting. And most of what I've seen in my, almost 30 years as a gastroenterologist is that people do things to mess up the gut. So GI diseases typically don't just fall out of the sky into our lap. And so we see the three big categories that we see in terms of things that are disrupting the gut and creating GI disease and GI symptoms are medications. I would put as number one, the medicine cabinet. So while the medicine cabinet is, a place we go to heal and cure disease, even, it can often be a place where disease is forming. So if we think about GI health, we think about three big categories of medications: antibiotics, which are ruinous to the gut microbiome, these trillions of live microbes that live in and on our bodies, mostly in our gut. And so whatever antibiotic you're taking that may very well be indicated to kill a pathogen, if you have an infection, those antibiotics are also destroying droves of healthy bacteria, which tend to be more fragile than the pathogen. So antibiotics, the second big category, are acid-blocking drugs called proton pump inhibitors.
It's like the stuff at the over-the-counter we get, like a Tagamet or a ranitidine.
No, those are the Tagamet belongs to a class of drugs called histamine blockers, H2 blockers, and those have other problems, but these are really the most potent acid suppressors called proton pump inhibitors. Mm-hmm. So that would be things like omeprazole, pantoprazole, lansoprazole that are marketed as Nexium and those Prilosec, those sorts of drugs, which some of them are over the counter. Those drugs are fabulous at their job, which is to block stomach acid. But in so doing, they completely disrupt digestion. They mess up the natural pH gradient, which is important for the microbiome. And they make us more vulnerable to pathogens because stomach acid kills viruses, bacteria, et cetera, that get in through the mouth. So these drugs are also hugely problematic. And then the third big category are non-steroidal anti-inflammatory drugs. So those would be ibuprofen, Advil, Anacin, Aleve, Motrin, all of those drugs, which again are very good at doing what they're supposed to do. They're anti-inflammatory for some of our joints, et cetera, but they cause real problems in the gut. They cause ulcers, they cause GI bleeding, they increase the intestinal permeability, and by that I mean they disrupt the gut lining. There are lots more drugs. There was a landmark study published in the journal Nature in 2018 that looked at 41 different classes of drugs, and they found that 19 of them were really disruptive, primarily to the gut microbiome. So I have to remind people all the time, none of these drugs are free. You may have a very reasonable and rational indication to use this drug, but it's also important to be aware of the potential downstream effects on the gut and to really be constantly doing that risk-benefit equation. So the medicine cabinet, unfortunately, Drew, it keeps me in business with these, drugs that people are taking, and often multiple drugs. The second big category.
Those are three of our favorites. Sorry to interrupt, but those are three of our favorites.
Yeah, they are. And again, believe me, I'm very glad that we have these pharmaceutical tools in our toolkit, right? I mean, antibiotics are arguably the most important medical invention in the last century. And the same thing, non-steroidal anti-inflammatory, all of these things are fantastic, but unfortunately, they can really wreak havoc in your gut. So we need to use them very judiciously. The second big category is food. And what we find is that the food, and you're a psychiatrist who is very focused on nutrition, so you know this as well as anyone, the food has changed. We are more than 50% of our calories, around 57% of our calories in America are now being consumed in the form of ultra-processed foods. And while these foods are super convenient, unfortunately, some of them aren't even food. They don't meet the basic criteria. They're made from bioengineered food-derived ingredients, but they're full of emulsifiers and pesticides and products that extend the shelf life. And we have very clear data that these chemicals in the food are not only increasing our mortality, they're actually making us die faster, but they are, for those of us who are, they're not killing us, but they are also wreaking havoc in the gut. They are interfering with the gut microbes. They are disrupting the gut lining. They are having really serious effects. We have data published that shows a strong connection between emulsifiers, for example, in the food and autoimmune diseases like Crohn's disease. So that is another really big area. And of course, we live in the real world. We're going to eat some convenience processed food and even ultra processed food, but we have to be really careful about what percentage of the calories we're consuming. And then the third category is squarely in your neck of the woods, and that's stress. And what does our stress management system and resources look like? Because the effects of stress in the gut, I mean, there is a study that shows that where they looked at college students, and they found that college students during exam time under high stress, levels of pathogenic bacteria in the gut were increasing 1,000-fold in an hour based on high stress versus low stress. So we know that stress actually changes the composition of the gut microbiome. It can affect the gut lining, making it more permeable, more vulnerable to passage by pathogens, et cetera. So this idea that stress is in our head, sure, but it's also physically in our body and particularly hard on our GI tract. So my main piece of advice, if you will, would be pay attention to what's in your medicine cabinet, judicious use of medication. Make sure you really need this drug. And I apply that same high bar to over-the-counter and supplements too. Number 2, pay attention to what you're eating. I think Michael Pollan gave the best advice of all: eat food, not too much, mostly plants. That's a great place to start. And number 3, even if you can't really do anything about the stress in your life, make sure that you have techniques, whether it's a mind-body practice, it's exercise, whatever it is, community support, family support. Make sure you have ways to really manage that stress because it can physically affect what's going on in your gut.
Can we start with those kind of in reverse? And I'm curious how that science and all that clinical knowledge translates to your life. Like when you're stressed and you have all this knowledge, like you're messing up your microbiome, the pathogenic bacteria are coming for you. Like, what are some of the things that you've learned, and maybe at different periods in your career, that have been really helpful to you in managing that stress?
I would say I've learned the hard way because, like many people, I struggle with this idea of, you want to be successful, you're ambitious, but you also want to have a good quality of life. And sometimes those things are really opposing interests. And what I've learned is I have to focus on fewer things. I have abundant energy and enthusiasm, so I'm often working on 4 or 5 things at a time. And I find that spending some time really thinking deeply about what these different options are, whether they're things in my personal life or whether they're professional opportunities, and narrowing it down to 1 or 2 as opposed to 4 or 5 is a really important part of my own mental health and mental fitness. And often I'm more productive. So at the end of the day, like doing less, focusing on less, usually means the outcome is better, right? And so that's been a big part of it for me, is realizing maybe you can have it all, but it's going to come at a cost. So really just narrowing my focus for what it is I'm trying to accomplish has been a big part of it. And I think part of that narrowing is also getting quieter, getting more still. Like you don't have to be running around doing multiple things, scheduling less, all of that. I'm a much more consistent meditator than I used to be. Very short periods of time.
When did that shift for you?
It shifted really when I was writing the last book, The Antiviral Gut, and I was doing so much research on sleep and stress and the effects of this, not just on the GI tract, but really on our immune system and vulnerability to pathogens. And I thought about, years ago in my career when I was on the board of one of our major GI societies and still full-time at Georgetown, a teaching hospital, and doing a lot, publishing papers. And we would have this big GI meeting every year in May called Digestive Disease Week, and another big one in the fall, the American College of Gastroenterology meeting. And I would always be sick when I was at these meetings because I was up late. There was always, you've been there, you maybe still are, where you're giving a presentation, you haven't finished the slides, or you're trying to get that.
One of my favorite
mentors that submission in.
Said, you can't bring your laptop to a meeting. And I said, what do you mean? And he said, I just bring my phone and you just present from the phone because otherwise you stay up late working on slides. And
Totally. Yeah. It would be like 7 minutes before the meeting and I'm before the presentation, you're still adjusting slides. So there'd be so much stress leading up to that. And then of course, travel, and then you're in a hotel and you're not eating as you should be and you're not sleeping. And so and I had to really examine that and go, you're always sick around these events. Like what's going on? And just feeling like, that FOMO you can have in academic medicine of like, oh, I didn't get invited to give a talk, or I have to be speaking like you can just say no to things. It's okay to just say, I'm not available. And then of course, you're not available for the meeting in Omaha, but you're available for the meeting in Rome. There's that too, right? A little bit of cherry picking, like, oh, you want me to come speak in Rome? I'm available.
Well, it's interesting. You said there's a cost to it, and I wonder if the cost of that, which is challenging for us, is actually pretty minimal. It's the cost of setting a clear boundary, and that's very difficult for all of us in a lot of ways. And then also, you joke, but prioritizing. Your family, that everybody could go to Rome, that if you're going to take time away from work, it's nice to, get a unique, nothing against Omaha, great place to visit, but also that, we call it cherry picking, right? Somehow that's a little, I don't know, bad. And I guess in data it's bad, but when it comes to managing yourself, managing your mental fitness, which, I love speaking with you because you're such a wonderful, vibrant example for us all. And he said, can you have it all? And I was thinking all, and it's to me, it feels like that means you have a really active lifestyle and a vibrant relationship and a family and a career that you care about and colleagues. And it seems like the answer you provide for us is yes. It takes more clarity in our and more boundaries, maybe, and more meditating.
Yeah, and more focus. I'm a huge Malcolm Gladwell fan, the writer Malcolm Gladwell, who's I guess does a lot of social commentaries, book like Outliers and The Tipping Point, etc. And he had a masterclass on writing, which I watched and loved. And one of the things he talked about in one of the segments was this idea about taking words out. And he said, when you are a writer and you're writing, and you are also a writer, Drew, when it's that first draft is your first draft. But he said, the more words you remove, the better the writing gets. And I found that to be so true, because you have to distill, all these thoughts that are roaming around in your head, and you're an expert and you know so much, but you have to distill it down into the most important things for people to absorb, the essence of what you're trying to say. And the fewer words you do that in, the clearer it is. And I do feel like that is also true for us in our professional and personal lives. You take all of these, opportunities, and you distill it down, and you have to really say, well, what is the most important and meaningful thing that I want to do? Is it that I want to write a book? Do I want to teach a course? Do I want to have an educational platform? Whatever it is you want to do, and to really do that one or two things, or okay, maybe three, to do those well.
Could you take that idea of focusing in and doing a few things in simple words? And I'm wondering, from a gut perspective, you gave us great ideas to think about where the culprits are. But I was almost wanting to play like word association with you around really the focused singular words that make a massive difference when it comes to people's gut health.
Food. But food is the trickiest because the definition has changed so much. I mean, you think about, I was listening to NPR this morning, and they were talking about language and how the English language has changed. But the person who was speaking, and I don't recall who it was, I came in midway, was saying our language, the changes are actually simpler than what happened a few centuries ago. So we're evolving in a simpler way for those who are complaining. But the problem is the definition of food. Because what we see on the supermarket shelves now, 90% of it wasn't around when our grandparents were figuring out how to procure food. And it is that definition. For me, food is something that nourishes you. That's the most important definition. And that's the part people struggle with because they're being marketed to. It's confusing. There's a convenience issue because, of course, people are busy. And they're being told so many conflicting things. And so for the gut, the simple focus to drill down is not a magic probiotic or an enzyme or a pill, but it is to think about how can you nourish your body through your gut engine, which is where it all has to get processed, right? Mm-hmm. And what are the best ways to do that? And of course, it doesn't have to be perfect every day. Mine often isn't, but I'm very focused on it. And I'm focused on it in a way, Drew, not of like, oh, I ate this thing and it was bad. I eat chocolate virtually every day, 6 out of 7 days. And that's just the way it is. It's good quality dark chocolate, not a lot, but I eat chocolate. But I focus on the food thing. Did I get enough green leafy vegetables? Have I eaten enough beans? Have I drunk enough water? I mostly walk around with my water bottle. I think we should just both take a little hydration sip break right now.
I'm drinking kombucha, so I'm also getting some live bacteria
Okay.
to try and get
Do
credit with you, a little brandless booch.
So I'm focused on that. How can I get in these basic ingredients of fiber and hydration and some microbiota accessible carbohydrates, which the best place to find those are in legumes.
Yeah, and can we talk foods? Because we're talking about food, which is great, but I think it's really wonderful to think about, like, we went to the grocery store with you. What are we going to see in your cart? And especially, what are we going to see in your cart that usually aren't in people's carts?
So I will start this by saying that my 18-year-old daughter, Sydney, hates to go to the grocery store with me, not because of what I'm buying, but because I'm walking around looking at people's carts going, oh my God, did you see? They're buying soda and they have little kids with them and there's soda in the cart. Or did you see that there's all frozen food? And I'm just, and she is so embarrassed. And she's like, Mom, like, this is a real world. Like, people eat this stuff, like, don't have a heart attack. So I'm walking around like, a voyeur, just in shock. So I'll tell you that we buy a lot of the same things. There is always hummus, a lot of hummus in our cart. And, wouldn't it be fantastic if we made our own hummus, but we don't. So we buy the extra garlic hummus, a ton of it. My husband eats it with everything. There's always ingredients for my green smoothie, which means kale, collard, spinach, celery, parsley, mint, lime or lemons, coconut water, and then whatever fruits around. Stone fruit are great right now, so lots of nectarines, sometimes mangoes. So there's always that for the smoothie. There's always lots of salad greens. There are usually eggs. There's smoked salmon. Our household is a little bit different. Like my husband's vegan at the moment. Sometimes he's not, but he is at the moment. My daughter and I are eating some animal protein. She likes chicken. I eat more fish. So there's some animal protein happening. There's tons of fruit, whatever is in season, or mangoes just all the time because she loves them and we can get them. And then, there's nuts. Typically, there may be some bread. It's usually a gluten-free bread if there's some bread. And potatoes. There's lots of rice, white rice, brown rice, quinoa. I really focus on things that don't have a lot of ingredients or ideally don't even have a label. We try and get as much as we can from the farmer's market, but that's not always possible. And there's no hummus at the farmer's market, at least the one we go to. So most of our greens are, potatoes, sweet potatoes, squash, green beans, corn, all of that stuff will come from the farmer's market. And then the supermarket would be for the more boxed goods like the coconut water and dried goods of beans and so on. But I really pay attention to not having a pantry with a bunch of canned things or packaged things. That is something I pay a lot of attention to. And the other day I was walking around, this was just a couple of days ago, aghast, and my daughter really had it. She was like, I'm going to leave you in the supermarket here if you don't stop going on about it, because I was in this supermarket, I will not say which one, and I was looking at some of the soups. I was getting some ideas for what soups to make. I love making soup. I love drinking soup. And I was looking at the soup and I was looking at the ingredients, and there was xanthan gum in all of the soups. These are the soups prepared ostensibly in the store. So I'm like, why is there an emulsifier in the soup? And there were lots of other things too, chemical things. And so I was like, okay, when I'm making soup at home, I'm not putting xanthan gum and soy lecithin and, all these things in there. So the food is, and my daughter's argument was like, well, it's not a big deal. It's a little xanthan gum. And I'm like, yes, but if everything you're eating, your plant-based milk and your soup that you're buying, thinking it's a homemade soup, and all the food that you're eating has these emulsifiers and synthetic products in them, it really adds up. So that's the concern.
Can you see how some of those things in processed foods like emulsifiers affect the lining of the gut?
Again, we have some really great evidence that there are really two things that we're concerned about. One is the microbiome and what are they doing to the gut bacteria? And we have evidence that they're changing the composition. And two is the gut lining, the permeability of the gut, and that they're affecting that, or they're essentially making holes in the gut, making it more permeable for pathogens, to toxins, et cetera, to get through and to potentially set up an immune response. So those are the two big ways that we know that some of these foods are potentially problematic. And again, if you're exposed to these things in a really small level, totally fine. But so much of the food, I see the teenagers going into the pharmacy and coming out with like groceries. And I'm like, okay, I don't think there's actually any live food being sold in there. It's all packaged, processed, bio-derived ingredients. And so I'm pretty focused on that. But at the same time, I've been known to eat me some Cheetos for sure, just not a ton, like on a road trip or...
Well, I think, kind of having that pattern, as you said, our cart always has these things in them. And getting into that dietary pattern and that habit where it's not like health food eating, it's a very nourishing way of eating that also is informed by all of your knowledge as a gastroenterologist. I think that, eating with you really is, and with other gastroenterologists is different. One of my best friends is a gastroenterologist because I don't know, you guys really have a good sense of the hardware of how it all gets dealt with. So it's
And I wasn't always a great eater. I grew up in Jamaica and my grandfather had a farm and we had access to he grew almost everything on the farm. They bought rice and some other products, but, my grandfather's Hindu and didn't eat pork or beef. So they had goats and chickens and geese. He did some fish farming, and then they grew tons of different fruits and vegetables. So I was lucky that a lot of the food was coming from the farm, and we had lots of fruit. We had mango trees and tons of fruit trees. So I ate a lot of fruit, and I ate beans and so on, but I wasn't a good vegetable eater. I mean, I was not the kid who would ever eat a salad. I think I probably ate my first salad in college. So wasn't a great vegetable eater. And even now, I mean, that's why I love my green smoothie, because I just put in all these vegetables and I suck it down and I'm like, okay, I'm done. I've had my medicine for the day. So it is, I try and mix it. Like there are things that I really love eating. I love like a big bowl of rice and lentils. And I try and eat a lot of that. And then there are things that I get in, like I've got to get in those leafy greens. And then there's, as I said, there's always going to be some chocolate. Maybe there's some ice cream some days too, for sure.
Well, I mean, I think you're noting that for a lot of people, a healthy dietary pattern can have that stuff. And the focus of that, getting rid of all that, isn't probably the best technique. It's good to get rid of all of that ultra processed food, but keeping in some of the stuff that's delicious, that maybe helps you or facilitates more of these more, nourishing foods.
The other, if I can just interrupt for one sec, the other tip I would give people is pay attention to how the food makes you feel. Now, that's not always something instantaneous, right? Because it takes a while. It can take anywhere from 24 to 72 hours for food to travel through the gut. But if you consistently notice that every time you have dairy, you feel gassy and bloated and uncomfortable, you don't need a gastroenterologist to tell you that maybe you should eat less dairy. Or, if you find that you eat beans and you get gas, still eat beans. I'll tell you that. But I love the idea of empowering people to be their own sort of medical detective, especially when it comes to the gut, and to start making some associations that something may be really good going down when you're eating it. You may love it and you're getting those dopamine receptors triggered. But then afterwards, you feel not so great, and to really pay attention to that.
I wonder if we can shift to some sort of ideas of how people take care of their gut, and starting with the notion of probiotics. So many people have a notion that, if you have a little gut health problem, take a probiotic, which are, freeze-dried bacteria of a variety of different strains and a variety of different concentrations. You'll see anything from 2 billion CFUs, which, just to put that in context, if you look at a kombucha, that's, a kombucha has usually like maybe 8 to 15 billion colony forming units. So, fewer probiotics in a kombucha, to 100 billion colony forming units and all types of different strands and strains, and they're usually somewhat expensive. Do probiotics help the microbiome or change it? And is it something that we should take?
We have very little evidence, like vitamins, that probiotics do anything for the average person. Now, like vitamins, there are certain conditions where people are vitamin deficient. You might have low B12 because you have Crohn's disease, and that part of the intestine where B12 is absorbed has been affected. Or you might have low iron because you have heavy menstrual cycle or whatever it is. And in those situations where particular deficiencies have been identified, we absolutely should correct them. But we don't have any compelling evidence that a multivitamin is doing anything. We know that people who take vitamins tend to have healthier habits. So we have, some sort of shifting of the data in that direction. So we have probiotics that have been shown to be enormously efficacious in particular instances. And these are typically not the probiotic you buy off the shelf. So for example, there was a study from Thailand earlier this year looking at a particular bacteria that was used in people who were colonized with MRSA, which is methicillin-resistant Staph aureus, MRSA, as it's sometimes referred to. And people who are colonized with this more pathogenic, antibiotic-resistant type of staph, as you know, Drew, are prone to getting infections. They get boils and skin infections and all kinds of problems. And even after the acute infection is gone, they're often still colonized. The MRSA is still in their body. Antibiotics to suppress the MRSA tend to not work because they just get more resistant. But in this study, they used a particular bacteria, and they found that that bacteria was effective at decolonizing these people who were suffering with MRSA at getting it out of their body by crowding it out. We have examples of stool transplants, fecal microbiota transplantation being very efficacious for treating Clostridium difficile, another sort of acute infection. We have certain probiotics that are used for enterocolitis, which is a very significant infectious inflammatory condition in the gut. I use a very potent probiotic, 900 billion colony-forming units, prescription strength, for my patients with ulcerative colitis, which is an autoimmune disease. And there are dozens of studies supporting that probiotic. But again, these are specific formulations that are often not commercially available or prescription, used for particular indications for particular periods of time. And always, in my case, with dietary change. Never like, fine, eat Cheetos and cheeseburgers, but just take this probiotic. So I think it's important for people to have a very realistic view of what probiotics can do. And they're always icing on the cake. They're never the cake itself. So it is, they're not this sort of magical ingredient. And if you are taking a probiotic, but you're not paying attention to the other things, to the medicine cabinet, to the diet, to the stress in your life, to the alcohol, to all those other things, you're not really going to accomplish very much, if anything at all. So I don't take a probiotic myself. I have access to all kinds of fancy ones, but I don't take it because I don't believe it's conferring an advantage to me over what I can get from food and exposure to soil microbes and all the other things that I recommend that people do.
How does alcohol affect the gut?
Alcohol, as you know, is metabolized to acetaldehyde, which is a carcinogen and also a toxin. So if you think about when you go to get blood drawn at the lab, they use an alcohol swab to clean your skin, and that's to kill microbes. Because before we had antibiotics 90 years ago, we had alcohol as the main way we could sterilize things. We've been doing surgery, as you know, for hundreds and hundreds of years, but we've only had antibiotics really broad spectrum since the 1930s for less than 100 of those years. So what were we doing before? We were using alcohol to sterilize things. So alcohol kills microbes. And that is, and just as it will kill microbes on your skin, killing the microbes in your gut. Alcohol is a toxin to the liver. It is a carcinogen the same way tobacco is a carcinogen, but in small amounts, you would probably be okay. So as we think about the effects, it's all about, well, what else is going on? If you have liver disease from viral hepatitis or from a medication and you were also drinking alcohol, you're probably not going to tolerate that as well on your liver. Alcohol damages the gut lining, it damages the gut microbes, it damages the liver. And the more of it you drink, the more of that damage. So a very healthy person can probably get away with some alcohol, and by some, the usual recommendation is 6 or fewer drinks in women and about double that in men. But I'll tell you, Drew, a lot of countries have revised those guidelines. So for example, in Canada now, they say there's no amount of alcohol. No amount of alcohol is safe, okay? And in the UK too, those guidelines have changed. So I think for the average healthy person, you can probably get away with a little alcohol, but I'm not usually dealing with the average healthy person. I'm dealing with patients with complex autoimmune disease, with Crohn's and ulcerative colitis. I'm dealing with patients with dysbiosis, a very disrupted, damaged microbiome. I'm dealing with patients who have been taking years of nonsteroidal drugs and antibiotics, and their gut lining is compromised. And in those patients, alcohol on top of everything else is a problem.
It's a really great point. That especially as you and a patient or anyone listening who's having gut health problems, is moving back towards rebuilding gut health. It's really a time to be very vigilant. I know a period in my life where I had really extreme gut health problems, and I had to be very, very strict. No alcohol, no dairy. I had to, some foods that usually I love and I do well with, like beans and legumes. I was having a hard time with it, and it took quite a while to rebuild everything back up. Whatever was going on down there now works, but
yay!
Not paying attention to that, which for some months it's kind of ignored it, like you said. Oh, it's a little this, it's a little that. It got very costly over time. When we think then about if probiotics aren't really going to help us very much, and we think about improving our microbiome diversity, And in our clinic and generally with patients, I talk about fermented foods. And it feels like the data, especially the study coming out of Stanford by Gardner
Yeah,
and
the
his group.
Sonnenberg's data. Yeah.
Yeah. Can you tell us a little bit about sort of how, when people want to restore gut health and a healthy microbiome, what are some steps we should be taking?
The Sonnenberg data, Justin Sonnenberg and his wife from their lab and other researchers who I don't recall their names right off, but are all doing great work, really compelling that adding fermented foods, and fermented foods, for those who might be less familiar, are this incredible combination of pre, pro, and postbiotics. So what do I mean by that? Prebiotics are the food that we are encouraged to feed our bacteria, and that's primarily fibrous food. So if you think of a product like sauerkraut, the sort of quintessential fermented food, it's cabbage, and cabbage is a highly fibrous food. So it's prebiotic, it's a high fiber food that our gut bacteria will ferment. A probiotic, by definition, is the live bacteria. And so in the process of fermenting the cabbage, you get a lot of production of lactobacillus, one of the sort of essential species in the gut, essential families in the gut. And then that fibrous food is fermented by the bacteria into postbiotics. And so those are metabolites of the bacteria, like the short-chain fatty acids we talked about. And so a fermented food provides prebiotic, probiotic, and postbiotics, and not just short-chain fatty acids. If you look at the Sonnenberg data, literally dozens of medicinal compounds that are being produced during, with this fermentation process. So they are really medicinal foods. And I talked earlier about microbiota accessible carbohydrates, MACs. And so those would be things like legumes, whole grains. It would be oatmeal and brown rice and beans and things like that, certain cereal grains, and the less processed, the better, of course. And those also feed the healthy population of gut bacteria. The fibrous vegetables, so onion, garlic, leeks, asparagus. When you're cooking broccoli, you want to eat as much of the stem as possible because that's where most of the fiber is, not in the florets. All of those things are really incredibly important. They are the poorly digestible or undigestible fiber that our gut bacteria ferment to produce these incredible compounds that keep the gut lining healthy and balance our immune system and are so important, not just for gut health, but for overall health. And as you said at the beginning of this, for mental health. So these are all the things that we should really be thinking about. And if we're getting enough of these things, yeah, we can have a bag of Cheetos or, eat a slice of pizza every now and again and be fine. So I really try to tailor my recommendations to the problem the person is having. If I'm at a cocktail party and somebody just wants general advice versus I'm sitting with a patient who has severe Crohn's disease and has had, half their small intestine removed surgically and been in and out of the hospital. That's a very, very different situation. And my recommendations are going to differ in that setting.
I want to just shift a little bit. It feels to me during our time as physicians, the idea that the gut is at the center of the immune system came about. Not really how I thought about the gut when I was trained, and now it really seems both quite true. But when we think about the immune system, we're really thinking about the gut. And I wonder if you can share a little bit of what that's been like for you.
I love that you asked that question, Drew, because I first want to tell people that I went to, I think, a great medical school, Columbia, and I did my residency there. I was chief resident there, and I had no idea really probably until a decade ago what the immune system was. So if me, a highly trained medical professional, could be so confused, I can really relate to people. I mean, it just seemed like this kind of ephemeral, like what is it? Is it like cobwebs floating around in our body? What is it? And so I want to sort of describe that for people in a way I think they can understand, and the relationship with the gut. And then talk about overactive immune system, underactive immune system, Goldilocks immune system. Because I think when you understand those concepts, you understand immunology. So let's start, first of all, with the gut and the immune system. You have the GI tract. It's this long, hollow tube that goes from the mouth to the anus. And the first thing that, is sort of obvious, but maybe also not so obvious, is that when something is in your gut, it's not in your body. It's in this hollow tunnel that's running through your body, right? It's this hollow tunnel that goes all the way down, through your chest and abdomen, your torso, but it's not in your body. The way your liver is in your body, that's inside. When something is in your gut, it's outside of your body. And the whole purpose of the gut lining is to present this highly selective membrane that decides what should get through and what should stay out. And of course, what stays out is what we're left with, the products of digestion that eventually, as they move through the GI tract, form into a stool and we excrete them. And those are the things that our body has decided, this is waste matter. This is dead red blood cells, it's dead bacteria, it's toxins and pathogens and poorly digested food particles that the body has decided, primarily the gut, should be excreted. So the first thing, again, is to know, where are the gut bacteria? They are primarily in the lower part of the gut, the colon, but there's, of course, some in the small intestine all throughout. And the gut bacteria are floating around in the lumen, in the tunnel. And then you have a mucus layer between the bacteria and the actual lining, in part to protect it. Right on the other side of the lining, on the inside of our body, are most of our immune cells, 70, 80% of the immune system, depending on, what textbook you read. But the majority of the immune system is located along the inner lining of the gut. So you have the gut, on the inside, the immune cells. On the outside lining, you have a layer of mucus and then all the bacteria. And there is constant communication between the bacteria and the immune cells. In fact, it's the gut bacteria that are telling the immune cells what to do, that are literally saying, hey, we got a serious problem. Ebola is in the house and you guys need to spring into action, versus, oh yeah, you see these millions and billions of bacteria passing through? No big deal. These are not pathogens, just ignore them. So literally, our gut bacteria are air traffic control that are saying, okay, you land, you stay in the air, you just move along the runway, guiding our immune system. And it is that physical connection, that hand and glove on either side of the membrane. You start to see too, Drew, that if that gut membrane is damaged, that process is going to be disrupted. So you start to see, like, physically how these three layers are. Okay, so let's talk about now immune function. Overactive immune system leads to autoimmune diseases where our body is reacting to our own normal tissue. Our body is saying, hey, these joints are abnormal, let's destroy them. And now we have rheumatoid arthritis. Hey, let's destroy the skin. We have psoriasis, eczema. Hey, let's destroy the gut. We have Crohn's, ulcerative colitis. So we're up to over 100 different autoimmune diseases, all basically an immune system that's taking normal tissue and saying, this is abnormal, let's mount a response and damage it. We also have allergies, environmental allergies, food allergies. That's also a sign of an overactive immune system. What about an underactive immune system? We have cancer and infection. Infection seems pretty obvious, right? If your immune system is underactive, it can't protect you. It can't mount enough of a response, produce the proteins and chemicals we need to destroy the virus, the bacteria, the parasite. But cancer too, because our immune system is involved in cancer surveillance, in going through the body and doing an audit and looking at all those cells. And the minute it finds a cell that's looking a little sketchy, getting rid of it. If a cell is multiplying abnormally and looking like it's moving in a cancerous direction. So what we find is that people who have a suppressed immune system because they're on an immunosuppressive drug, or they're born with an immune deficiency, or they have an acquired immune deficiency like AIDS, their main things that they get are infection and cancer. And people with an overactive immune system get autoimmune diseases, allergies, etc., react severely to bee stings, that kind of thing. So how do you get that Goldilocks immune system? It's not really through a pill. In fact, it's not through a pill at all. It's through looking at what modulates the immune system and keeps it healthy. And again, it's those post-metabolites. It's having a healthy complement of gut microbes, a healthy intact gut lining, and an immune system that's being guided by these products that are created by the gut microbiome. And, of course, there's some genetic factors, et cetera, in there, but that's basically how it works. And so I think many other people, even as a gastroenterologist, we weren't really focused on the gut immune connection until, a decade or so ago. So, there've been just some incredible advances there. And Drew, I tell you, I struggle sometimes because people come to see me And I'm trying there thinking, how can I make this sound sexier than eat more vegetables and stop taking all the Motrin? At the end of the day, like I'm trying to, let me talk about some cytokines and intestinal permeability. But at the end of the day, stop doing the things that are damaging your gut and start doing some things that are going to help your gut.
Yeah, it sounds like a very complex system, but some of the operating instructions are pretty straightforward.
Pretty simple.
And some of where the problems have come from are pretty clear. I mean, I think, there's often a question we get in mental health about the mental health epidemic and where's it coming from? Are we diagnosing too much? Or is it all the plastic? Or is it social media? And, those are all relevant questions. I think you could probably also ask, not social media so much, but some of that was gut health, right? Is it the new food? Is it pollution? Is it the environment? Yeah. And I think that complicated view is important. The science is fascinating, but it misdirects us at times from very straightforward and I would say very necessary steps that people need to take, that we all need to be taking. We're kind of joking that a little processed food is okay. I think in that joke is, as physicians, we know that that's not how it's in most people's lives.
Yeah.
And
I think you raised such an important point there, which is, how do we give people this information in a way that makes them feel empowered rather than blamed? We know that part of pharmaceutical marketing is telling people it's not your fault and there's nothing you can do. This is not your fault. There's nothing you can do. Just take this pill. And sometimes that's the case, but most of the time there is stuff you can do. If you think about common conditions like high blood pressure and high cholesterol, sure, there are some genetic predispositions, but for the most part, these are diet and lifestyle issues that people are dealing with. And even if you cannot completely control your blood pressure through changes in your diet and your lifestyle, you can generally make some significant improvements and maybe need less medication or hopefully none at all. And so there's a way to give that message to say, hey, I'm really sorry you're struggling with this. It sucks. Here are some things that you can do that are going to make a huge difference. And you're going to be able to avoid or reduce the side effects of these drugs that work, but come with some not so desirable side effects. But people often hear that as it's, we're saying it's their fault and they're to blame. And so I think there's a real art, and this is where we need help from people like you as psychiatrists to be able to give this message in a way so people realize that we're not blaming them. We are trying to empower them. And I encountered this on social media. Maybe it was earlier this year or last year. I'm not super active on social media intentionally, but I did. When I feel compelled to share something, I do. And there was a study showing that the maternal diet had a huge impact on RSV. This is over the winter where we were dealing with, people were talking about the tridemic flu, COVID, RSV. And of course, we know that premature babies whose respiratory system isn't fully formed are at high risk, but there are a lot of other risk factors. And it turned out that a maternal diet that was high in starchy, sugary carbohydrates made a huge difference. And that study showed that the morbidity and mortality of those infants was much, much higher based on the maternal diet. And so I shared this information. And most people were like, wow, that's really interesting. That's so good to know that this is something that we can modify and pay attention to. But there were a few people who were like, well, why are you shaming pregnant women? And I was so taken aback. And I was like, look, when we realized the connection between tobacco and lung cancer, we were not shaming smokers. I mean, imagine like millions of people died because they didn't know about that association. Like, this is empowerment, and this is important for us as physicians to share this information so that people can be healthier. Now, you can act on it or not. And I don't think anybody in a neonatal ICU would ever think about blaming a mother whose baby had RSV. That's not the point. The point is always empowerment. But I think we're in a climate where, you say something that suggests that we can play a role, we can make ourselves better, and it's often taken as, you're blaming the person. But if we don't really look deeply into what we can do, both as a society, making good food more accessible, more affordable, et cetera, really addressing food swamps and maybe even more important, food deserts, and maybe even more importantly, food swamps. If we don't do that collectively as a society, and if we don't do it individually, we are surely lost when it comes to our health. We'll just continue to get sicker and sicker and sicker and be more reliant on pharmaceutical remedies that themselves have side effects that then need more pharmaceutical remedies. So it's something I'm very passionate about, and I'm constantly wrestling with how to present it in a way so that the person feels excited and empowered rather than blamed. And it's again just something that I struggle with. And I wonder, I mean, you probably have the same situation when you're dealing with somebody's mental health issues. You're dealing with somebody who's struggling with a mood disorder, and maybe they're living in a way their diet and lifestyle are contributing to it. And how do you approach that in terms of then trying to engage them rather than make them feel even more despondent?
Well, I think a diagnosis comes with some responsibility, and a lot of times we don't want that. And whether it's a soft diagnosis, like we're burned out, or we our lipids aren't quite on, or we've gained some weight and we're not feeling good about ourselves, right? Or whether it's something significant where we really need to take time understanding the management. If you have a major depressive disorder, if you have alcohol use disorder in your family, or if you have a mood cycling disorder, there's a responsibility that nobody wants. It's not like, I'll take that. I'm going to take that burden, and at the same time to really function at someone's best. As I sort of talk about understanding the car you're driving, and that we can wish we were in a different car. Oftentimes we do, about our situation or our neurotic thoughts or parts of our bodies or things. But sitting in that reality of working with what you have and being responsible with it, I think is sometimes, because to me that means it's also being responsible with your potential, and being responsible with the self, I think, is a very empowering notion. Not that I'm always going to make the best choices, but I'm going to have appreciation for the self and for its needs, my own needs. That I think one of the shifts that people make in therapy is acknowledging the patterns, kind of pathological patterns, by which we really are desperate for someone to know and someone to care and someone to see us in a way. And those are all very beautiful human wants. We all have that. We all love that in some ways. But there is some kind of adult truth around the need we have to provide for ourselves. Not that we can't be dependent. I think dependency and even codependency, can be really some of the healthiest states. The idea that, like, wow, I love you and trust you so much, I'm really dependent on you. Like that's actually in some ways like the healthiest. That's the healthiest that one can be, right? Vulnerable, open, thoughtful, giving. But to this notion of responsibility and how to motivate people to be responsible, I think you're very spot on to note this tension of, it's not your fault, here's a solution that a pharmaceutical model has promoted, and that in some ways works. I think that's where it's so challenging, like with antidepressants, that when people take them and feel better, it's not that simple, because, well, is this me? Like, what does this mean? And and at the same time, boy, if you have horrible depression and anxiety, to get relief, it's a miracle. Yeah. It's wonderful when the medicines work. And so at the same time, though, that's not it for most people, right? There's more of, I don't know, you've been depressed for a year. There's what's happened to your relationships. There's the lifestyle factors, as you know, that relate to, after you get out of depression, not having a relapse. And so I think, although, your simple question of how do I talk with people about kind of responsibility, I think because I'm a psychiatrist, I get a special amount of time to sit and wonder, who is going to do this? And what if there is a perfect pill? And what if none of us had to exercise? Would we still do it? And to really get a sense of patients' values. Because I think one of the things about being a physician is that, if you have depression and you don't want to exercise and you don't want to eat all the brain food, that doesn't matter. You can still be my patient. I'm going to still do everything I can to get, those are your values. And I think that's one of the very hard things about medicine, or underappreciated things about medicine, that it's not about just cramming evidence down people's throats. It's about partnering with people to let them achieve their goals. Some people don't want to take care of things right now. Okay.
That was so beautifully and helpfully put, the idea of the responsibility of diagnosis in a way that's going to allow people to sort of unleash their most powerful self. And I also loved what you said at the end, that no matter what, they're still going to be your patient and you're going to do your best for them. And it's one of the things I love about being a doctor. And I point this out all the time. We live very differently, but we suffer similarly. And when somebody, you go down to the radiation oncology unit at the hospital and there's 5 different men being treated for prostate cancer, and one is a CEO of a Fortune 500 company and one is a bus driver, and they're all having a shared experience. And similarly, as somebody's doctor, I don't care what their political affiliations are. I don't care how wealthy they are. I don't care where they live, what they do. And I don't care. Well, I kind of care if they're following my advice. I would like them to. But if they're not, there's no punishment. I tell people when I look at their food journal, I'm like, look, I want to see what you're actually eating, not what you aspire to eat. That's not helpful. There's no judgment.
Dr.
Let me show you
Chutkan's
mine.
green smoothie, more mental.
Let me show you mine. You'll see that I, had ice cream 3 times in a row last week, but I had my green smoothie every morning. So, but again, it is this incredible honor, as you know, it is this incredible honor and privilege to be let into people's lives, whether you're primarily being led into what's going on mentally, or in my case, I'm being led into what's going on maybe internally in their colon. But we are being let in. We are being given really this bird's eye view. And we have an ability to help. And we have an obligation, a really, a sacred duty to help in whatever way we can. And, when I first came to Georgetown, I don't know if they still have it, but I've been on the faculty there since 97, but there was a clinic that was very active. It was called a medical illness clinic, chronic medical illness clinic. And it was a psychiatric clinic for people with chronic medical illnesses. And I thought, well, everybody with a chronic medical illness actually should have access to this too. If I think about the diseases I take care of, primarily autoimmune diseases, Crohn's and ulcerative colitis, these are diseases that usually strike people at a young age, before their 3rd decade. They're lifelong. They're essentially incurable, even though they can be put into a deep remission. And they can affect you, tragically into, bowel obstructions, bleeding, intestinal resections, incontinence. I mean, it is serious diseases. And yet it should almost be obligatory that if you're dealing with a chronic autoimmune disease or something like this, or you've had a cancer diagnosis, that is just part and parcel of your treatment, right? How are you coping? How are you managing? But yet it's something that's very neglected, except in few circumstances. So it would be, just as you and I are joined up now through the gut-brain connection, it would be great to see more joining, more lumping instead of splitting with the way we approach medical conditions.
Well, I love that, Robynne. And I think there's such a acknowledgement in the GI world about the amount of mental health stuff going on. And I think you're very right to point out that when we silo medicine, that if you've got ulcerative colitis or Crohn's disease, it also means, again, whether you meet diagnostic criteria or not, it means that you're going to have some mental health challenges, because to have a chronic illness is to be challenged in your mental health, right? Robynne, I want to first thank you. It's a real treat getting to collaborate with you and getting to really, you're one of those colleagues who had books before I had a book, but have really encouraged and supported me. And doing that has really helped support nutritional psychiatry and mental fitness and the existence of this podcast. So I wanted to have you on early to say thank you as a colleague, and also thank you as a multidisciplinary colleague. As everyone who's been listening is noting, you get psychiatrists and gastroenterologists into a room. These days, there's a lot of discussion on very actionable steps that sometimes just sound like, hey, eat the vegetables, eat more nourishing food. But, as Dr. Chutkan takes us on a tour from the top to bottom through the gut and helps us think this is a really nuanced organ that looks different, that does different things. And when we think about nourishing it with real food, it has a huge impact for us. I wonder if you could leave us, I'd just like to ask everyone, if there's a mental fitness tip, mental fitness being those things, those behaviors, activities, habits, thoughts that we keep with us, we hold close to our heart because we know that with those things, we can transcend our mental health challenges. And I'm wondering, what is one for you that really resonates?
It's gratitude these days. And I feel like, especially with the pandemic, it really changed so many things. The other day was about, I guess it was last week. I'd been on vacation for 2 weeks. And as you and I had discussed, I had a bad accident and the tail end of that, and a horseback riding accident in Iceland. So I came back with a very messed up ankle, immobilized in a boot. And I walked into my office the first day back at work with a busy schedule ahead of me, and nobody had been in the office. And somehow we'd had terrible rain and flooding in DC, and water had come in under the door, which I have a door that goes to the outside to the street, and completely ruined the floors in the foyer of the office, which I had just renovated the office earlier this year. And so the floorboards were all up and warped, and so warped and raised up, in fact, that I couldn't even open the door to the outside. And I had to ask the building engineer to come and remove planks. And it was just such, it was, I'm in this boot and the floor is jacked up. And then my first patient was a patient who's been a patient of mine for decades. She has terrible Crohn's disease. She's a few years younger than me. She's a single mom. She adopted a child several years ago, and she now has recurrent rectal cancer, which was diagnosed a few years ago and is recurrent. And so she is trying to figure out how to stay alive to see her child graduate from high school. And I am whining about torn ligaments in an ankle and a messed up floor. And I'll tell you, it just completely put it in perspective for me. I've never felt so grateful in that moment, honestly, of, where I am and where so many people are. And when I say grateful, I mean, yes, big picture, but small things. I'm grateful for my home. I'm grateful for the wonderful, nourishing food that we have access to in Washington and that I can afford. I mean, the food is so expensive now. It was shocking when you come out of the supermarket at what things cost. And I'm constantly thinking, like, how can somebody afford this? I'm grateful that I can send my kid to college. I got the first tuition bill, and I have to say I was, had a little bit of agita. So I'm grateful for my life, for the things big and small. I am grateful that even though my ankle is jacked, it will eventually heal, and that I have a healthy body, that I can move, and all of these things. And I'm optimistic. I'm seeing a revolution in healthcare that is not led by us, the physicians. As you know, it's led by the patients. They are demanding answers to that important question. Why? Why do I have depression? Why do I have ulcerative colitis? And what can I do? In addition to all the things you are recommending, what can I do? So we are in an era of self-empowerment like we've never seen. We have this new frontier of the microbiome, which is a most exciting development in medicine, certainly in my lifetime. And while it's not magic, and there's not a magic pill, we are realizing that how we feed and nourish ourselves affects how we feed and nourish our microbes, affects how our body works. And there's incredible optimism there, because we know that unlike our genes, which are more static, we can affect significant change in our microbiome in relatively short periods of time. And so I'm grateful for all of this. I'm optimistic. I'm grateful that I am involved in it, that every time I see a patient, they teach me something. I can pass it on to somebody else. Every time I have a conversation with an amazing colleague like you, I learn something. I can pass it on. So it's an exciting time, despite, all the terrible things that are also happening at the same time with climate change and,
I love this notion.
Inflation and everything else.
I appreciate the gratitude for sure, but I also love, in some ways, the core of your mental fitness tip is remember to appreciate that we're living in exciting times. And just because I think it sometimes gets a little overwhelming, and sometimes I think we can certainly miss that. Well, Robynne, thank you. Thank you for helping us keep our gut healthy and for all of your work making gastroenterology more accessible and helping people understand some of the simple wisdom that exists out there is really backed up by such deep science. Everyone, please check out Robynne's books. And Robynne, where can people learn more about you and your work?
They can find me at gutbliss.com, one word, GUTBLISS.com, or my very challenging name, both first and last to spell, which is RobynneChutkan.com, ROBYNNECHUTKAN. I think Gutbliss is easier. Similar information on both sites. They can check me out on Instagram at Gutbliss, which is probably where I'm most active, or they can buy one of the books, the latest one, my fave, The Antiviral Gut. And it's just such a pleasure to have this conversation with you. I think you bring such important information to the conversation. As I said, we're helping to lump people, to bring us all together, to unite us, not just the patients, but also the practitioners. So I really thank you for that.
Well, thank you, Robynne. Let's keep it going. I can't wait till the next time we get together and maybe host a workshop or see each other at a conference. And everyone, please take these messages and the ideas in this podcast. And as usual, I have a very simple request, which is just try and take one of these ideas and use it to improve your mental fitness. As with each episode, we all get a little something, a little nugget, and there were a lot of them in this episode. Over time, it feels like together we're going to build this really wonderful toolbox of ideas and techniques and foods to utilize in optimizing and maximizing our collective mental fitness. That's what we're after. And I look forward to being with you on that journey. So everybody, I'll see you next episode. There'll be lots of show notes and all the links to all of Robynne's material and books. And it's been a real pleasure. We'll see you down the road. Thanks so much.
Thanks so much.